Good morning, sir. I'm Hersherdula from BSN3H, and now I will be performing insertion of NGT to the client. So first, assessment, doctor's order, client's level of consciousness, level of knowledge, and understanding. Check for history of nasal surgery or deviated septum. Assess patency of nares. Determine presence of gog reflex. Assess mental status or ability to participate in the procedure. Planning. Before inserting a nasogastric tube, determine the size of tube to be inserted and whether the tube is to be attached to suction. So prepare equipment. Large or small bore tube, non-latex preferred. Non-allergic adhesive tape, 2.5 cm or 1 inch wide. Clean gloves, water-soluble lubricant, facial tissue, glass of water and drinking straw. 2 to 5 ml syringe with an adapter. Basin, pH test strip or meter. Bilirubin dipstick, stethoscope, disposable pad or towel, clamp or plug optional. Anti-reflux valve for air vent if saline sump tube is used. Suction apparatus, safety pin and elastic band. CO2 detector optional. Implementation procedure. Introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do. Assist the client to high Fowler's position if his or her health condition permits, and support the head on a pillow. Place a towel or disposable pad across the chest. Perform hand hygiene and observe appropriate infection control procedure. Provide client's privacy. Assess the client's nares. Prepare the tube. Support the patient during the procedure. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client's nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the cypod. Mark this length with adhesive tape if the tube does not have markings. Insert tube. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Insert tube with its natural curve toward the client. In the selected nostril, ask the client to hyperextend the neck and gently advise the tube toward the nasopharynx. If the client gogs, stop passing the tube momentarily. Have the client rest, take a few breaths, and take sips of water to calm the gag reflex. Ascertain correct placement of tube as per the stomach contents and check the pH, which should be acidic. Confirm by X-ray. Place a stethoscope over the client's epigastrium and inject 10 to 30 ml of air into the tube while listening for a whooshing sound. Secure tube by tapping it to the bridge of the client's nose. Evaluation. Evaluate client's response to the procedure. Document the procedure and other important data on the client's chart. Good evening, sir. I'm Hersherdula, your nurse for today. And may I know your name, sir? Okay, sir. To inform you, I will insert the tube into your stomach via nasal.